Mute. Hello, welcome everyone to the Network Commons. We'll wait while people sign in. Great, I can see people heading in. We'll take a couple of minutes. Welcome everybody. Feel free to share in the chat where you're coming from as you're coming in today. Okay. Well, as the number's still going up, I'm going to start and just really offer everyone a warm welcome to the Network Commons. Build Healthy Places Network is really excited to share a slightly different format to our webinar today. So some of you may be joining us from NACEDA, the National Alliance of Community Economic Development Associations, which is one of BHPN's partner networks. And others are joining us this webinar as part of Build Healthy Places Network's regular Network Commons series, which you may be familiar with or not, which is dedicated to cross-sector strategies to improve neighborhood health and well-being. So regardless of where you're joining us from today, welcome all. And I hope that you, your families, and your communities are healthy and safe. And certainly in a year where we've all reached pretty much outer limits of Zoom fatigue, we're very grateful and humbly thank you for setting aside the next hour to join us and talk about how the healthcare and community economic development sector can work together to advance career pathways amongst marginalized people and places. So my name is Ruth Thomas-Squance, and I'm the Director of Field Building at the Build Healthy Places Network. And we're a national center whose mission is to transform the way organizations work together across the health, community development, and finance sectors to really more effectively reduce poverty, advance racial equity, and improve health in neighborhoods across the US. So today we're going to take a closer look at the recently released resource that we developed together with NACEDA that's entitled Community Economic Development and Healthcare, a Playbook for Cross-Sector Partnerships. So I'm going to begin by introducing Frank Woodruff, who's the Executive Director of NACEDA. So Frank.
Thanks so much, Ruth. Hi, everybody. As Ruth said, my name's Frank Woodruff. I'm the Executive Director of NACEDA. For those who aren't familiar, NACEDA is a membership network of 35 state and regional community development and affordable housing networks. We have, those membership networks touch about 4,000 community-based organizations across the country from the community development sector. And we put this report together with BHPN to lift up the practices and purpose of community development organizations to help them perform at their best. We wanted to acknowledge the funder of the report. Under contract to ICF, the Playbook was created with financial support from the U.S. Department of Health and Human Services, Administration for Children and Families, Office of Community Services. So we want to thank our departments at partners at HHS for funding the report. The webinar you're participating in is a product of BHPN and NACEDA ourselves. So as you all know, the Playbook is arriving on the scene here early in 2021 amidst a global pandemic and nationwide mobilization for racial justice. The links between health and social equality have really, I mean, one could easily argue, never been clearer. And they've been laid bare as low-income communities and BIPOC communities have been disproportionately impacted both economically and through their health by the pandemic. But the challenges that the pandemic has made clearer have been made clearer by the pandemic, at least to mainstream America, as probably most of us know, existed long before March of 2020, and how healthcare and community economic development have been working together to fill those gaps for years has been relatively underexplored and understudied, particularly when viewing that work through the lens of a community-based organization. And so NACEDA and BHPN began to have conversations about how to fill that knowledge gap in 2019. And through the process we went through, the result is the playbook and webinar you're participating in today. The topic of career pathway development is urgent and has urgency for several important reasons. One, far too many people in the communities we serve are out of work, obviously. Two, the eyes of the world are focused in a way right now that has been unprecedented on the role that health systems play in our daily lives. Three, we as in BHP and NICETA have recognized a heightened awareness the last 5 years or so about how community economic development and healthcare partnerships can build career pathways and improve community health. And fourth reason this topic has urgency is that the health sector is becoming increasingly aware, slowly but surely, of the ways that historical underinvestment and systemic racism can impact health. So I'm going to spend just a few minutes introducing the guts of the playbook, orienting you to it before we get into the stars of the show today. The playbook, BHP and NICETA, we intended it to be action-oriented, and it's designed, although it can be useful for many audiences, it was designed for use by community economic development organizations and social enterprises at the local level. It provides practical guidance for how these organizations can create career pathways for people living in low-income and BIPOC communities. And we designed it for those who are familiar to the Network Commons, certainly, but also more broadly. We designed it as almost a sequel or an add-on or a deeper knowledge learned from BHPN's healthcare playbook that the organization designed in 2018. They're meant to go hand in hand. Our report being released draws on in-depth literature review and interviews with at least 36 stakeholders from multiple sectors. So with that, I'm going to share my screen and orient you to the guide. This will take just a minute. Hopefully everyone can see the screen. So what we did with the playbook is we went out and explored and tried to identify categories of activities that community-based organizations are undertaking with healthcare systems to create career pathways. And we found 5 categories. The first is training for career pathways. This could in some ways be thought of as workforce development, though there are important reasons why we framed it differently, because not all jobs are created equal, and jobs that have career pathways are critically important and too often lacking in the communities we serve. Under this category, you'll see case studies from Some Others May Eat in Washington, D.C., as well as from Nationwide Children's in Columbus, Ohio. That was the first category. The second category is support for local entrepreneurs and small businesses. How are community-based organizations in partnership with healthcare systems supporting local entrepreneurs and small businesses? This section explores that category with case studies by Metro West Community Development in Cleveland, Ohio, and Destination Crenshaw in Los Angeles. And under this category, we have a special treat that both Ricardo Leon from Metro West and Miranda Rodriguez from LISC, Los Angeles, will be here to discuss their projects later on in today's webinar. The third category, health facility development and financing. This category explores 2 case studies where community organizations are helping actually develop health facilities in low-income communities and the intended and sometimes unintended benefits that can come with that type of activity. 2 case studies from the Gulf Coast Housing Partnership and Odyssey House in New Orleans, as well as a case study from Kentucky Highlands in development of the Pineville Community Health Center in Kentucky, obviously. The fourth category, healthy food of activity we categorized as healthy food access and food sovereignty. We found a lot of overlaps with community organizations and healthcare systems when it comes to food in a lot of different ways, from just access to healthy food for low-income people angle, through supporting small business that offer culturally relevant food and provide a family wealth, as well as health. There's just a lot of different angles on this one. It was pretty, and so it rose to the level of having its own category. 2 case studies in this category are from LISC ProMedica in Toledo, Ohio, as well as Midtown Cleveland and University Hospital in Cleveland. And the fifth category is leveraging assets from health institutions. This category explores the purchasing power as well as other kind of anchor institution kind of assets that health institutions offer, and how community organizations build off of those assets and improve them for the residents that live in those communities. Two case studies here from Northside Development Group and Spartanburg Regional Healthcare System is the case study featured in this category. And we have Carrie Rothschild from Spartanburg Regional Health System on hand with us during this webinar, who we will hear from later. A lot of these case studies that we found overlapped a lot with these categories. For the purposes of putting forward the playbook, we kind of forced them into a category in some cases. They're obviously complex. We don't need to tell the people on this webinar that, but these are the 5 common threads that we found across our research. And finally, some would say the most interesting part of this book, and perhaps the most useful, at least in the short term, part of the playbook, is the pathways for career partnership, a step-by-step guide towards the end of the playbook that offers 4 steps to how to think about developing a partnership with a healthcare system that creates career pathways in your community. I'll go through really quickly the 4 steps. The first that you see on your screen is to assess. First step is to assess the potential partnerships in your community, where they may exist, what gaps and opportunities there are. The guide offers some links to some helpful resources that get a lot more in depth on this step, as well as questions to start asking yourself about your community and what the gaps may be. The second step in the 4-step process is mapping your network around the community assets that you identify, and as well as the institutions, obviously healthcare institutions, how to put that map in writing and start asking yourself and others probing and tough questions. The third step is how to make the case to your healthcare institution, how to frame your case that accomplish your interests, as well as how to consider the interests of your prospective healthcare partner. And the fourth is will give you some resources as how to think about how to start building the structure of a potential partnership. So that's a real quick and dirty on how to get through the guide. Basically 5 big categories of case studies we found, and then a step-by-step guide to get you started. With that, I'm going to conclude just by saying that, you know, our country right now we have a long path ahead of us for the communities we serve. And we hope that this path ahead and this resource we're offering you here today will lead to better outcomes, really to better outcomes, both in terms of health, and community wealth. So with that, I'm going to introduce Hannah Hassan before we get into our panel discussion. Those familiar with NCEDA events will definitely be familiar with Hannah and her work and her craft. For those who are experiencing Hannah and her work for the first time, Hannah is an award-winning acclaimed spoken word poet and storyteller based in Charlotte, North Carolina, who believes that our stories can set us free. Having heard from me, I kind of described to you via a PowerPoint presentation the concepts of and mechanics of what is in the playbook. NCEDA and BHPN hope that Hannah's performance will help you feel the spirituality, culture, and heart that went into the playbook. So with that, Hannah, I offer you the floor to share with us the healing power of community.
Thank you so much, Frank. Good afternoon, everyone. I am really excited to be here today, and I will jump straight into the poem that I've written. To understand the needs of Black people and Indigenous people and other people of color is to understand and embrace their history of healing. It exists in the ground of the health and wellness of the people. It exists within their approach to healthcare. There is tradition, folklore, spirituality, religion there. There are practices passed down from one generation to the next. Holistic healing rituals deeply rooted in nature and nurturing, connected to the earth and the land, crafted with care and respect. And within that history, There is a common thread that connects all to exist in a space where healthy is a priority and the mind, body, and spirit are in unity, an approach with ancient ties that bind us all. Healing cannot happen in silos. Healing happens in community. Healing happens in communities of healthcare providers and social enterprises and groups and organizations all working together to work a vision that serves the people, that empowers the people to rework the system, to create a system that pays honor to their own culture and families, to their own practices and traditions, that ultimately gifts them with healthcare providers whose worldview reflects their own, whose experiences and journey through life reminds them of home, healthcare providers who they can confide in, and healthcare providers that they can trust, who treat them like they are deserving of hope, whose bedside manner reflects justice and love. Healing happens in communities that center economic upward mobility, who understand the understated truth of whole community health. Those who exist within the margins deserve the opportunity to be invested in and ultimately to build generational wealth. They deserve their own practices and institutions that reflect the needs of those within their fold. They deserve their own healthcare centers and healing spaces that nurture their neighbors and help the resources grow so that power shifts, so that momentum is built, so that life is extended and that past harms are healed. There is resonance in this moment, an opportunity to create career pathways that close the gap, a time to leverage assets with equity and intention, space to partner and strengthen partnerships. This is the moment to build momentum, to require culturally relevant food security, to nourish souls while nourishing the whole of the community, to train healthcare providers based on the needs of the people, to pull from what has worked in other spaces, to provide resources and assistance to marginalized businesses, entrepreneurs, and organizations, to explore jobs that become careers that heal, to make the pursuit of racial justice by ending disparities in healthcare real, to invest in technology that keeps up with the time, and to ensure that healthcare professionals of color are decision makers and responders on the front line, within the patterns of the traditions of old, within the pages of the new playbook that has been written. We find a pathway to create spaces for all to embrace healthful living as we build together, grow together, share resources, and fight for the resources and wellness of all in intersectionality, within solidarity, and in unity. We honor the past as we create a future that ensures healing cannot happen in silos. Healing happens in community. Thank you.
Wow. Thank you so much, Hannah, for sharing your art and your talent with us today. That's wonderful. So in that spirit of seizing our moment for momentum, I'm just going to briefly turn it over to the audience to see who is in this virtual space with us today. And we're going to share a poll, and I think it should be coming up in your screen, where you can share what sector you represent. And just we can take a quick look at who's with us today, because this is all about cross-sector work. And I'll just give you a minute to fill that in. Probably less than a minute, but okay. All right, let's see what results we're getting. And it's on the screen. We have representation, community advocates, 7%, a lot of community development, welcome, some representation from government, healthcare, welcome, some multi-sector, so already crossing those spaces, 5% from philanthropy, some policy research folks on board today, and public health. And 16% other, the mysterious group, which we'll not see. But thank you for joining us all. So it's interesting to see we've got a good spread of people. So great, I'm just quickly going to run through some housekeeping, won't take long for the webinar today. We're going to use two of the Zoom features, which you're probably very familiar with by now. At the bottom of the bar, there's the chat and the Q&A. If you have any technology issues, please use the chat box feature and we can troubleshoot with you. Suzanne will be in there providing also information throughout the webinar. To provide questions for our speakers, please use the Q&A feature. That way we can collect your questions. We can have definitely have a Q&A session at the end. And we also encourage you to tweet if you have any ideas, comments, or innovations that you hear that are compelling. We can use hashtag Network Commons, and we'll add that along with other Twitter handles from BHPN, NCEDA, and the speakers in the chat box. So finally, throughout the conversation today, we're providing links in the chat box for resources that come up in our discussion. And that just leaves me to introduce, I'm very excited to introduce our guest panelists, three very impressive leaders from organizations that featured in our playbook, as Frank mentioned, that are doing innovative work around economic development in communities in all different parts of the country. So we're going to share their full bios in the link, but I just wanted to briefly introduce them. First, I'd like to welcome Ricardo Leon, who is the Executive Director of Metro West Community Development Organization that's based in Cleveland, Ohio. And he leads a multifaceted team of community development practitioners offering a suite of services to three of Cleveland's near west neighborhoods, Stockyards, Clark Fulton, and Brooklyn Center. And next, I'd like to welcome Carrie Rothschild, who is the Director of Community Health Policy and Strategy for Spartanburg Regional Healthcare System in South Carolina. And her work is focused on developing the strategic direction and oversight of the Community Health Department for Spartanburg Regional Hospital System, while also building partnerships and collaborative efforts that aim to improve local health outcomes and ensure health equity for all. And finally, I'd like to welcome Miranda Rodriguez from LISC, the Local Initiative Support Corporation, which is a national community development financial institution. And at LISC, Miranda serves as the Deputy Director of the office in the Los Angeles office of LISC, where she leads their economic development programs and community development capacity building initiatives. And she has the opportunity to drive strategy, resource development around small business ecosystem building, inclusive procurement strategies, and employee ownership models and microfinancing for diverse small businesses. So thank you all for coming today. We're really pleased to have you join us and excited to share some of your work. So I'm going to kick off our discussion with a few initial questions for our speakers, but we'll be sure to leave plenty of time for Q&A at the end. And I think I'll first start by asking all three of their speakers to really briefly describe their organization, perhaps just a few words about your particular community development and healthcare partnership, and then tell us why focusing on these partnerships on career pathways is important to advance racial equity. So Ricardo, I'd like to start with you.
Thank you, Ruth. Good morning or afternoon, everyone, depending what part of the country you're in. Ricardo Leon with Metro West Community Development. Metro West is one of like 17 or 18 CDCs in the city of Cleveland. We serve 3 near west neighborhoods on Cleveland, Cleveland southwest side of the city. And our neighborhood is pretty unique and it's like incredibly diverse. And it's actually really the predominantly like only Latinx neighborhood in the city of Cleveland. There's a couple other neighborhoods that have small populations, but in our neighborhood is over 41% Latinx. And one of our sub neighborhoods, Clark Fulton, that's almost 60%. And so our community development healthcare partnership is actually with our anchor institution. I see a few folks from our anchor institution, the Metro Health System, here in the crowd. And so about 2 years ago, we kind of embarked on this plan of partnering with our anchor institution, our local elected official, Councilwoman Jasmine Santana, Ward 14 here in Cleveland, the Cleveland Foundation, and the city of Cleveland to look at a comprehensive master planning process for one of our neighborhoods, specifically the Clark Fulton neighborhood, which is home to the Metro Health System and has historically been one of our most overlooked neighborhoods in the city of Cleveland, particularly on the west side of Cleveland. And so this partnership really aims to create a comprehensive plan, and as a part of that plan, workforce development, right, and workforce opportunities is a very big, piece, right, because we understand that in order to improve the quality of life for folks in our community, we need to connect them to high-paying opportunities, high-wage opportunities. And so really the why this is important to us is that ultimately in a neighborhood like ours, a neighborhood that's kind of on the cusp of gentrification, right? Is, you know, there's significant amount of investment pressure for the first time ever. Really the only way for our community to be able to kind of sustain that investment pressure and be able to really maintain the culture and social fabric here is for our folks to be able to take ownership of their community, right? And in order to take ownership of their community, they need to have access to better paying jobs, long-term career opportunities, and then ultimately that can turn into ownership opportunities. And so this comprehensive master planning process will allow us, ourselves, the hospital system, and our partners to create a toolbox to start addressing these issues and hopefully start kind of giving some of that power back, right? That power sharing back to folks in our community.
Wonderful. Thanks so much, Ricardo. Carrie, let's turn to you. So Spartanburg Regional Healthcare System. Can you hear a little more about that?
Yeah, sure. Spartanburg Regional is in Spartanburg, South Carolina, which is in the upstate of South Carolina. We are a nonprofit integrated healthcare system, and we have close to 10,000 employees. We are not a 501c3, and we're a political subdivision of our state. We don't receive any tax dollars from the community. So we operate a little bit differently than many health systems around the country. We serve 4 counties in South Carolina and 2 in North Carolina, pretty expansive. A few years ago, we acquired 2 rural hospitals and are now the sole provider in much of our service area. We have 5 hospitals currently. We have a research and teaching hospital with residency programs. We have 120 physician practices in these 2 states, primarily in South Carolina, that range from primary care to specialty care. We also, something unique to our health system is that we have our own construction department. And that was essential to the program that we're talking about today, which is a construction apprenticeship program that initially began as a place-based project focused on one of our city's most under-resourced neighborhoods we call the North Side. And this is a partnership with the North Side Development Group and Spartanburg Regional and other partners. It's grown over the years and includes not just the North Side neighborhood, but also it's expanded to include the whole city and then to the county of Spartanburg and now
the needs of Black people and Indigenous people and other people.
And we're now working to really expand it into a couple of our neighboring rural counties. The program has 2 primary goals: to help create well-paying jobs for members of our community for local hiring, and to fill the need for skilled labor in for our construction contractors, developers who were really having a hard time finding and keeping skilled labor locally. I think this is important for the health system and particularly for building the health of our community. As Hannah really eloquently stated in her poem, and I'll make a mess of trying to repeat it, but she said something about the importance of having healthcare providers who are representative of the patients they serve. And I think that's really important, not just for our healthcare, not just for our doctors and nurse practitioners, but for the whole team in a health system to really reflect the community that we serve. And part of this is done through helping local people obtain jobs and the skills they need to get the jobs in our system. And the other part of this is really in building trust. And I think it's important to the health of our system and to our community at large to have a skilled and diverse workforce.
Absolutely. Thank you so much, Carrie. Yeah, that's really important. That inclusion and that trust building, all that process has definitely got ripple effects. Miranda, great to hear.
Yeah, hi, good morning. And thank you so much for having us be a part of this conversation.
Yes, you're hearing a little bit about LISC. and national.
Yeah. So for those of you who don't know LISC, we're a national community development financial institution. We've been around for just over 40 years and have local staff in 35 urban markets and 2,000 rural counties across the country. Here in LA, we invest both capital and capacity building resources into the field to support access to safe and affordable housing, small business preservation and development, and living wage job creation in low-income communities of color throughout the county. About 2 or so years ago, we started to build a more intentional relationship with Kaiser in both the LA and San Diego markets. And at the time, LISC LA was just starting on an initiative with a set of community partners to create a 3-year economic inclusion implementation plan for South LA, which is one of our most historically underserved Black and Brown communities in the area. And the goal of the plan is to create an integrated set of programs and resources that'll provide South LA residents, businesses, and our commercial districts with the opportunities to access and benefit from the growing regional economy and anchor institutions in the area. And Kaiser recently built a new facility in the Crenshaw corridor in South LA, and they had a lot of success with local hire and procurement during the construction phase of their campus. And we're super interested in investing in a long-term talent district and small business development strategy for the area. So they invested some grant and lending, small business lending dollars to advance our plan in the Crenshaw corridor. And then in addition to the financial resources, we've also been working with them to try and create local supply chain, local spend, and workforce development opportunities for the area. And of course, when COVID hit, our community partners had to pivot, and we've spent the last year or so focusing more on small business preservation and connecting legacy business owners to emergency capital resources, pairing them with local youth to help get them online, and helping them reopen and rehire as here in LA, the economy begins to stabilize and open up. And as many of you know, BIPOC-owned small businesses are a super important enabler of intergenerational wealth creation and job providers. And both LISC and Kaiser recognize that losing a large share of our small businesses would destabilize our communities and further exacerbate the racial wealth gap in the region. So for us, entrepreneurship is a really important career pathway, especially for South LA and our BIPOC and immigrant communities that have been locked out of traditional high growth career sectors. So it made a lot of sense for us to kind of double down on that in this time.
Yeah, so important. Well, thank you everyone for sharing those, really interesting perspectives and really geographically diverse. From our research, it was clear that there's really no one size fits all scenario to address health and racial equity through careers, and really, neighborhoods at the local level are all culturally diverse and have individual and rich histories. And we look at some of the distinctions of the projects and strategies covered in the playbook. I'm interested to hear a little more about your projects, but also the different perspectives you bring from the sectors you represent, as you approach these kind of partnerships. So if I might start with you, Carrie, from a healthcare system perspective, how did Spartanburg Regional get on board with the project you described? And if you could also mention a bit about how you approach centering racial equity in the process.
Sure. So in 2010, there was the Northside Development Group was created, and that is focused on one of our historically under-resourced neighborhoods in the city. Spartanburg Regional provided some seed money, was one of the first initial investors and partners, and has continued to be part of that group. We have a designated staff member on the board, and my predecessor was that designated person several years ago when this idea was being talked about. And it was really born out of frustration related to the wonderful development that was going on and had been going on in our community for several years. And there was a focus on building our downtown area and this heart of the city, which is houses the north side as well. And one of the things that was happening, there's this great development and things going on, but the skilled labor workforce was not here. And contractors and developers were frustrated by not being able to find local individuals to hire. We were also looking at the demographics of the North Side itself and realizing that one of the most important things that needed to be addressed was job creation and connection and providing skills to the neighbors in our neighborhood to be able to fill those positions. And so my predecessor said, hey, the hospital has a construction program. I wonder if we could, help get people trained. And she approached the construction manager. They did some research, found NCCER, which is a global accreditation for construction. And hospital staff began in the construction department, became eligible to teach classes and started teaching the classes. So after their normal work hours. And some of the heavy lift there was in creating, addressing liability issues and agreements to have people on the hospital grounds that weren't hospital employees officially. And we worked through those kinds of things. And we even now have grown to the point where we have a couple of paid apprenticeship positions. It's really benefited the hospital too, when we think about it, because our health system was having a hard time finding those skilled construction people and keeping them. And so this is like an on-the-job interview almost when they're in an apprenticeship position. So we have hired several people from the program that have completed it, and they've been great employees. I'd say it's important to us we are an anchor institution here in the community. We're one of the largest employers in the community. And as that sole provider of healthcare for many in our service area, this is about developing the community economically and building trust, and that benefits the health of our health system too.
Yeah. Thank you so much, Carrie. Great points there, about that sort of the cost of losing employees and not being able to retain them as a framing for this. So Miranda, moving to you as a CDFI, launching this kind of partnership, could you explain any sort of capacity gaps that you had to address, or when you started this partnership that you needed to fill, and the role that this played in that kind of process?
Yep. So as a financial intermediary, LISC often acts as a bridge to funnel resources between large institutions like healthcare, universities, municipalities, and local community organizations. Folks often work in silos, and so it takes a long time to build trust and build capacity to be able to have kind of a resource-rich relationship. And so part of what we like to do at LISC is help set the table and bring together a diverse set of stakeholders that don't always have the opportunity to collaborate with each other. And in the case of our South LA implementation strategy, the integrated approach has really enabled us to bring together a set of unique capital resources and partnerships to the work. And so LISC, we act more of like a quarterback, I would say. And we're able to convene a group of South LA community-based organizations who have long, deep, rich histories in the area, with regional economic development players and city and county staff to help invest and advance in the strategies, that collaboration has really helped us leverage different strengths and resources, especially in this time when the need has been so great, and really getting out, being super intentional about getting out all of the public resources. This network was sort of essential in doing that efficiently and making sure that South LA was well represented in a lot of our public small business grants and other opportunities. And then in other capacity issues, this has been a year, and our original grand plans, especially around workforce and talent development, are a bit delayed because of COVID. And, you know, already in the best conditions, that work takes a lot of time. And so right now in our role, we're really advocating with our funders and our partners for longer timelines and a bit more flexible resources to give our team and partners the space that they need to get the work done. But not only to do that, but also to be able to collect the impact data and evaluate the programs over time, which we feel is something that as a field we could do a bit better, and to be able to communicate, you know, the long-term health advantages of community development work.
Yeah, thank you, Miranda. That's great. Yeah, and I think it really sort of points to that intermediary position, being able to help do what one of the things we've got in the 4 steps, that sort of identifying the bright spots and assets in the community that can contribute, you know, successfully to partnerships like that. So important. So speaking to the community developers perspective, Ricardo, for a community-based organization embarking on a partnership with health, what kinds of things are necessary when you were approaching healthcare partnerships, and how have you dealt with any capacity issues?
Yeah, definitely. I mean, I think it's interesting when anytime a CBO, community-based organization, is partnering with their anchor, you know, I think oftentimes there's like some initial like mistrust or distrust or like tension and like, oh, are we all on the same page? And I will say, luckily for us, this process hasn't played out that way, right? Metro Health has been a willing partner. You know, they've wanted to do this for quite some time. I think the biggest question mark was always the resources, right? Like, well, how are we going to pay for this thing? And I think that's one of the things that has been the most interesting about this partnership is that, you know, the CDC could have done this process alone, right? In theory, we could have kind of gone out there and done a community plan, but it probably wouldn't have been it probably wouldn't have been as high quality. It probably wouldn't have been as impactful, right? And so because of the partnership that we have with our anchor institution, that allows us to leverage that relationship to bring resources to the table, right? Bring folks in who maybe wouldn't historically or traditionally be interested and involved in a community-based plan. And it also allows us to then kind of think a little bit more outside the box and think about, well, how can we leverage the investment that the institution is making to their own campus, right? They're investing $1 billion in their own campus, but how do we think about how that investment then trickles out into the community, right? And has ancillary effects, right? Positive externalities that then we can help shape and inform and bring opportunities to the table. You know, a very small example, but like perfect example of this is, you know, right now, actually today in about an hour, I'm going to be sitting outside in 40-degree weather because we have this thing called eXplore Cleveland, right? This opportunity that every CDC in the city of Cleveland has had, where we have a week where folks come to our neighborhood, right? We market our neighborhood and like eat from restaurants in the community. Well, last week we partnered with Metro Health to get 5 local businesses, and Metro Health purchased 100 meals a day for 5 days from the local businesses and gave them to their frontline workers. And so that's direct cash into the hands of small businesses in our community. It also helps their frontline workers, and it also creates more of those relationships, those opportunities. And so like the plan itself is one element, right? It's like one piece of this larger puzzle that has allowed like so many more relationships and partnerships and collaborative efforts to happen, because it's all rooted back to how do we then incorporate this into the community plan itself. And again, for us, for a CDC, and, you know, the Cleveland CDC industry is a little unique, and where we get funded through some federal dollars, and, you know, not a lot of other CDC industries across the country are like that. But for us, resources is always the biggest hurdle, right? We need resources to be able to do the work, to get folks out in the neighborhood. And because of our partnership that has opened up so many doors that the CDC would not have been able to open up on our own. And so that's why the partnership has been so beneficial for us. And then again, ultimately, I think the last thing that we've had to deal with in our neighborhood, and this probably comes up in a lot of other communities, is that language barrier, right? Having that relationship with Metro Health has allowed us to kind of take all this information, bring in the resources that we need to be able to put everything out in Spanish and be bilingual and kind of be very intentional in the way that we interact and engage with the community. And then ultimately, the end product will also be both in English and Spanish, will be available to folks in our community, so we can start beginning to create kind of that buy-in from the Latinx community that, again, unfortunately has historically been kind of overlooked here.
Yeah, well, that's a great example. Thank you, Ricardo. Yeah, really thinking about bridging the gaps when we sort of go on to these new cross-sector partnerships, you know, that are really not business as usual, as it were, to explore new ways to working, which is really necessary for tackling some of these largest systemic issues. So I'm keeping an eye on the time. I know that we have lots of questions in the Q&A, So I mean, I'm just going to say, as we, we also have an element in the playbook where we really have some forecasting and looking forward, and we really expect to see a lot of racial justice at the core of local efforts that elevate community voices as we create career pathways. And especially, I think, when we begin to address the extraordinary disproportionate impact of COVID that has had on some communities, as we mentioned in the playbook, there's really been never a clearer connection between race and place and health and prosperity. So the kinds of opportunities that we're talking about being generated in the playbook are going to be essential. As we move forward, I'm just going to say, for a last quick question, as we round it up, as we respond to this at a national call, what is the unique value add? Just briefly, if I can get our panelists to mention, what do you think the unique value add is of community development and healthcare partnerships in these efforts, particularly with our focus on career pathways, but as Ricardo mentioned, and how that can lead to other sort of collaborations within the community. And what do you really think it brings to the table, and what's needed for success? And perhaps just going forward, what do you expect to see from these kind of partnerships? Miranda.
Yeah, so at LISC, everything we do is about, closing the racial wealth gap. And our partnership with Kaiser in LA, San Diego has since grown, and Kaiser is working with 5 other LISC offices across the country. And in other cities like Toledo and Houston, we have long histories, working with healthcare institutions, and have built successful bridge training programs to connect folks to nursing and medical assistant career pathways. And I feel like these relationships will only become more normalized as the healthcare and community development sectors start to deepen our relationships and begin to speak the same language a bit more. In LA, we're looking forward to working closer with our partner to create sustainable career pathways within the institution, activate local Kaiser employees to get into the community and shop and spend in the Crenshaw corridor, and create more opportunities for South LA businesses to access supply chain contracts and grow their revenues, and ultimately be able to create more jobs within the neighborhoods.
Yeah, that's great. Thank you. Kerry, just we haven't got much time, but just a few words from the healthcare perspective on that.
Sure. I think it's important for us to look at the way we do things currently and get out of our box and look at changing things. Sometimes there are simple things we can do, making it, removing barriers, unnecessary barriers to employment, whether it's removing the need for a South Carolina driver's license for a job that doesn't require driving, to looking at helping make the process of application for a job easier. We really need to walk our walk, and we know that systemic racism poses a threat to the health not only of our patients but to the community at large, and we have to be a change agent in that, and to encourage not just the health sector to participate in this, but it benefits all sectors. So I think, we are and we will continue to work more intentionally with our community partners and find ways to creatively address the issues that are especially predominant in many of our most under-resourced communities.
Absolutely. Thank you, Kerry. Ricardo, anything you'd like to add just from the community development perspective?
Yeah, definitely. I mean, I think the value add for us is being able to root the work of the healthcare system in community, right? I can firmly say that, like, Metro Health is a leader in the social determinants of health space, right, nationally and from a public health perspective. And that has worked its way into kind of everything that they do and how they then engage the community. A good example of this is, Metro Health has been working with our local community college, Cuyahoga Community College, to create a workforce development opportunity, a training opportunity. And then us understanding that was happening, the CDC knowing that, we partner with 2 of our local CDCs that are actually on the other side of the city, on the east side of Cleveland, who I think are here, Midtown and Burnbell Carr. And we created a workforce hotline. And so we're pairing basically our workforce hotline with the efforts that the hospital are doing to try and get folks into job opportunities there, right? So because we have this relationship, we can kind of be synergistic with each other, where they see what we're doing and then they build programs around that, and then we do the converse. And so it has worked out really well so far in being able to identify these opportunities for collaboration.
That's wonderful. Well, thank you, everyone. That's a great start to our conversation. I'm going to turn it back to Frank now to moderate some Q&A from the audience. Frank.
Thanks, Ruth. We'll jump right in. We got some good Q&A questions in the chat. I'll combine two of them to Carrie. You're up first. Carrie, are you exploring supporting project with other community organizations as part of your project, in addition to the ones you've already mentioned, is one question in the chat. And I'm going to ask you to comment on this next question too. I'm going to lift it up a level. Are there planning documents, public or otherwise, or processes that community organizations can look for to get a sense of a health system's direction before they engage with you?
Great questions. I'll answer the second one first. I would say that it's really important to reach out to individuals if at all possible. And most health systems do have planning departments and staff that work in community health, or we might call it population health. And so I think the more often you can connect with somebody individually and tie the projects or the work that you're interested in doing to the strategic plan of the health system and their goals, the better. Really align that work to find what the sell is for the health system. The other one was, yes, we are partnering in many different ways, from work on food insecurity in the community to work on building. We're focused right now on an exciting project building the workforce of community health workers here. So that's an exciting thing, trying to elevate that profession as a desirable and well-paid profession, and finding the way and then walking that walk of valuing with dollars the lived experience that is so valuable to caring for our patients.
Are these planning documents or similar commonly on your website?
You know, I don't think that we have the planning documents on the website, but I would be happy. I'll put my email in the chat. And if anybody wants to reach out to me individually and I can understand exactly what you're looking for, I'll connect you to the right person to get that.
Cool, thank you. And this next question is for not directed at anyone in particular, but what have been your greatest challenges to hiring locally and retaining local hires, if any, and how have you engaged those challenges?
I can speak to, we have financial opportunity center networks, and within them, they're called Bridges to Career programs. And a lot of that programming is really trying to bridge some sort of educational gap that folks have to be able to even kind of access a career ladder. And one of the biggest hurdles we find is oftentimes we're serving single moms. And so taking the time and having the resources to be able to even participate in a training, 6, 12, 20-week training program to get you to a job is tough. And so raising resources to be able to provide stipends is really something that we always try to do to ensure folks' ability to participate meaningfully and get the skills that they need to bridge into a career. So I would say that for us has been is one of the biggest challenges to get started.
I would echo kind of all of Miranda's sentiments for sure here in the Cleveland market. I think the other thing that we have here and probably experienced in other MSAs is Cleveland doesn't have the best public transportation system, certainly very much 20th century. And one of the biggest paradoxes we have is like, you need to be able to get to a job to have a job, right? And getting there oftentimes is an issue, right? Here in Cleveland, an organization I'm on the board of, the Fund for Economic Future, has created this program called the Paradox Prize, which looks at kind of unique ways of investing in alternative transportation, right? That is not our traditional public transportation, but that is always kind of an issue, in addition to all those other gaps. It's like actually just physically getting to the jobs, right? Most folks aren't living in those business districts where the jobs are available to them.
Great. And so this will probably be our last question from the Q&A for you all, but what we're To the extent you haven't addressed it yet, what were some of the biggest challenges you had or your community organization partners had to just getting started? And what kind of pushback did you receive? Or was it just super easy?
I think, you know, building a relationship with a large institution is really hard, and you have to, it takes a few different tries to figure out who are the right people to connect with, especially in a large healthcare institution that's national. So we have a lot of relationships within the institution, and navigating those and being able to build those took a long time. Took like at least a year, starting with our national team, coming down to the local, going back. To be able to get everybody to kind of understand what is LISC, what's a CDFI, what's community development, like all of that it's a journey. So I would say that was kind of our biggest, the biggest impediment, but also sort of our value as an intermediary was that we're able to do that and have the capacity to do that.
I totally agree. And I would also say that it's imperative to have the right people in the room. You need leaders who can make decisions, who have the hierarchy and the ability to be able to bless things. But then you also need, you know, your worker bees and your people who are more boots on the ground and have those more personal relationships with the community partners, which very often our C-suite does not. But you need both involved, and sometimes that's a heavy lift and can be frustrating and complicated. And then I think something else that takes time is the building the partnerships and the trust within the community. It's not just trust for healthcare, it's trust between community partners. It's been amazing to me in my career of working with different nonprofits and now in healthcare, how often we have such turf, and you know, we work in silos. We hear that a lot, but you know, building relationship, being honest about what's in it for my organization, what's in it for yours, and where do we overlap, and what do we have that would benefit you and you us is really important.
Great. And one last question, I want to squeeze this in because I really like it. But we have a question from higher ed, and what role do you see for educational institutions in any of your efforts, if any at all?
I think that's a huge one, and we're working with some of our local colleges. We actually have 7 just in the Spartanburg County area on a community health bachelor's program. We're working in being advisory on the School of Nursing boards for colleges, and looking at developing this community health worker certification and having it available through a local college would be pie in the sky for me. I'm really excited about that opportunity. And then partnering with those colleges to make sure that students are prepared for the jobs that we have open and are hiring for, and that we create internships and other shadowing opportunities to make sure it's a good fit and that students know what they're getting into.
Ricardo, I didn't cut you off earlier. Did you have anything else? Or did I? I cut you off?
I mean, Carrie pretty much said everything I said. I would say the only, you know, here we're seeing a lot of our local higher education institutions are involved in a lot of these efforts. And, you know, they are kind of think tanks that have a ton of creativity and innovation and have access to a ton of human capital, right? Just like folks that they can get in front of. And so that has been one of the best things, is like having a partner that can be kind of a spokesperson, right, you know, for this effort, and then drive folks to it, has been huge, you know, across the city.
Great. Well, thank you. That concludes Q&A. We got to almost every question. There was one question that was asked about 18 times. Yes, we will share Hannah's performance and the link to it. I noticed no one asked for a YouTube link to my performance, but that's fine. With that, I'll pass it back to you, Ruth.
Yeah, thank you, Frank. And just want to thank again our panelists, Miranda, Ricardo, and Carrie, for a great conversation today. To our audience, I just want to say, please continue to share your questions and comments via Twitter. You can use the hashtag Network Commons and the other ones we shared. Before you go, we're going to share a very brief survey, literally 2 minutes or less, in the chat, which would be really appreciative if you could help us get feedback and filling that in to keep our material relevant and of interest. So I think we're going to share that in the chat now. And if anybody's missed, or you or your colleagues, you know someone who's missed it, we will be sharing this a recording of this entire conversation on the both of the Healthy Places Network YouTube channel, but also the NCEDA website. And we'll follow up today's webinar with an email that includes any other links to Hannah's video and any other information that you want to share. So just thank you so much to everyone for your attention today and for engaging in this really important dialogue. Stay safe and stay well, everyone, and thank you.